I'm Dr. Stacie Grossfeld. I'm an orthopedic surgeon from Louisville, Kentucky. I'm doing a series on Did I Tear My, and today we're talking about meniscus. Well, your meniscus is a shock absorber that lives in your knee joint, and it helps to cushion your knee joint. And you can tear it, actually. In fact, they tear quite commonly as we get older or if we have knee arthritis. They're kind of hard to tear if we're a younger patient. They occur with typically a traumatic event as a younger patient, such as an athlete playing basketball or soccer, or in association with an ACL tear. But as we get older, we can tear our meniscus getting out of a chair. So as we get older, the tissue of the meniscus gets less resilient and is much easier to tear. Typically, the signs of a meniscal tear is a pop. You'll feel a pop involving that knee. Now, as we get older, sometimes we don't feel the pop. We will just have pain involving the knee joint. And it will be a sharp pain. Typically, arthritic pain is a dull, throbbing, aching pain. Meniscal pain is sharp, and it occurs when you plant and twist. So if you're straight line walking or sitting, you may have no pain at all, and you won't typically have pain at night from a meniscal tear. But if you plant and you twist, that's when you'll feel the meniscal tear, and it will be a sharp, stabbing pain. There will typically be a slight effusion, which means there'll be a small amount of fluid, sometimes a large amount of fluid, but typically just a small amount of fluid in the knee joint. So when you look down at your knee, you'll notice a difference, or you might not be able to bend it as much because there's fluid in the knee joint. The fluid comes from the tear that produces an inflammation, which then produces the fluid. Pain will occur with squatting. So a simple test is go ahead and squat, go all the way down to the floor, stand up. If you have a sharp stabbing pain, that is probably a meniscal tear. And again, if you're just walking, you plant and twist, and you feel a sharp pain, that would be a meniscal tear also. Now, it's a consistent pain that's located in the same spot, where knee arthritis can hurt sometimes on the inner part of the knee, sometimes on the outer part of the knee, sometimes on the front of the knee, but a meniscal tear will always hurt in the same spot. So if you've torn your lateral meniscus, which is on the outer half of your knee, it will always hurt on that outer half. If you've torn your medial meniscus, which is in the inner part of the knee, you'll always feel the pain on the inner part of your knee. Thank you.